really just introducing it to the general population, because no one really talks about like lutein and zeaxanthin as anything. It's not a topic of conversation, but everyone talks about blue light glasses, right?
Sure. In your world, yes.
When I say everyone,
yeah. Because it's the opposite in my world, right? Like, because it's the complete opposite. People are like, oh my God, blue light glasses, that's like a new thing. Whereas we are talking about like antioxidants.
Yeah. So really it's fundamentally talking about the in to the out versus wearing the glasses. And it's basically an antioxidant that's not very well versed in the general population. And where almost everyone, I mean, going back to the American diet, we're getting low levels of lutein. And the argument is, with all these new impactful things that we're getting environmentally, including the blue light, are we actually trying our best to, keep it from damage and preventing
is it enough
in the future? And then that's where it gets into the conversation. And then I want to talk about my palm scanner, where it's like a proactive way of knowing what type of, what level of zeaxanthin and lutein you have within the skin. It's basically non-invasive, so we can extrapolate perhaps some of the things that might actually be more prevented in the future and increasing your lutein and zeaxanthin ingestion, knowing that it's actually doing something that's targeted, considering the macula is where 90% of all the lutein in your body goes to, including brain health too. And that's a whole nother can of worms. But, it's just making that awareness. Yeah. How are we doing?
I am not winning.
Okay. How does my audio sound to you guys?
You sound good. I feel like I forgot my headphones.
You sound okay to me, except for a couple times your audio went out and I like it you just went quiet for a second, but I don't know if that's me or you, to be honest. Okay, let's just keep it obvious, whatever, let's not overthink it. Let's keep it how it is. I'm just, like I said, I've run into this issue before and I just prefer to dial in just in case.
So that you're just ready. Yeah.
Well, that way, just so that I'm like because then it uses I'm on Wi-Fi here, but I'm on cellular here. And so if my Wi-Fi puts it out, my cellular is usually pretty
picks it up.
Yeah.
Yeah, usually you get a telephone number that you can actually just dial in, but I cannot see this on the invite. And
yeah, it's not on the invite because the setting for the meeting is do not allow people to dial in. I don't know why that setting exists. Like, why would you do that to people? Like, why would it be like, no, you're not allowed to use your phone? I don't know.
I don't know. I'm sorry.
No, it's
I should be better at this.
You didn't invent Zoom. That's okay. Did you?
Yeah. Don't ask me about Zoom.
Okay, well, I'll leave it up to you two. Have fun. I'm just gonna be in the background.
Hold on. So are you jumping off then? And you're just
No. I'm just
staying on,
and I'm kind of making notes and stuff in the back.
Okay. So here's the other thing that's gonna happen. Again, yes, I'm sorry. I'm always this bossy. So I want to just make sure that the recording comes out well. Because there's 3 people here, there's certain recording options. If you log into your Zoom account and you look at the recording options, just make sure all of them are listed, and then you can choose the one that comes out the best. Because I'm worried that it's going to show this pain and it's going to look weird with Ruin being in there, but he's not really talking. Right? And it won't show, it'll sort of show 3 people, but only 2 of us are talking. But there is one of the capture options in Zoom is to just switch panelists, and then that will solve that problem, if that makes sense.
Yeah, so basically,
because I'm probably not using the right terminology.
I actually turned myself off, so I'm hiding myself because I'm a non-video participant. So it will only show the 2 of you.
So it will only show the 2. Okay, so that's fine. No offense, Ruben, but like it just
no problem. I don't want to be in the video. Okay,
like,
so
who is this lady? She comes on, the first thing she does is tell me what to do about the audio, then she kicks me off the call.
It's totally fine.
And-
I'm so chilled and responsive today. So you caught me
Good,
on
I
a
like
good
you
day.
already. Awesome.
Okay, so
Awesome.
I'm gonna mute. You have
Okay.
fun.
Thank you.
Sure.
And then Netta, what I want to do is just take advantage of the fact that we're both here and just do a quick little IGTV where we just say, we just got up, we just recorded this thing, blah, 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 and like a, you know, sort of like a summary of it and where they can find it. Just to put that on our Instagrams. IG Live.
Sounds like a blast.
Okay, sarcastic.
Oh. Anyway. All right. You set up good?
My webcam is for some reason not working because it's Mercury retrograde, and so I have to use my laptop cam, and I'm not happy about it because it's super like granulary. Let me fix it.
No. You could pretend you're in the 70s.
Yeah, I do. I feel like I'm in sepia right now. Like, that's exactly right.
I know. I'm
Okay.
just happy I have a new iPhone. Okay. Ready?
Whenever you are.
So I am talking to Miss Lara, or I like to call her Sensei Lara, because Lara is not only the foodie pharmacist, but she's also my CNS supervisor.
I am.
Yes.
It's my honor to be your supervisor.
Thank you, Sensei.
And you're teaching me so much about the relevance of nutrition and eye health. It's pretty cool for me too. So just so you know.
Well, I guess that's where the conversation starts, where when we think of nutrition, right, we think of that general nutritionist or somebody that we're, correlating it with some sort of weight loss or a program. And that's kind of a little bit dated because now there's so many subspecialties, and you're also well versed in other specialties, not just pharmacy, but that can really incorporate the proper nutritional targets to improve a condition.
Yep.
And I think that's where the problem is in medicine, where we subspecialize so much and we lose that cohesiveness. And, the fact that, eyes are, directly correlated. It's a direct correlation and direct connection to diet and lifestyle, of course. But, we don't really talk about how to help ourselves in some of the most important subspecialties that we have so many problems with.
Right.
So I think that's one awesome thing where you really are able to help these subspecialties really bring in that nutrition part, because it's not a separate entity. And that's where I think my focus is I don't want to separate the two. Why not bring it together?
And that's the ultimate goal, right? Like when we talk about personalized nutrition and personalized medicine, we want the two to be cohesive. You're going to have folks, especially in the nutrition world, that are going to have specialties in areas of focus, passion projects, and, areas that they just naturally gravitate and learn more about. But at the end of the day, I always say, like, you have to be a little bit of a generalist too, and you have to be able to view it from the scope of, yes, your practice, but you have to be able to connect all the dots, and you have to know a little bit about everything in order to be able to apply it. So yes, your focus is the eyes, but that doesn't preclude you from having to understand how hormones fit into that picture, how liver and detoxification and kidney function fit into that picture, how gut health fits into that picture, the microbiome. And so it's I call it like a two-sided view, where you're on one side looking at it from your specialty and your lens, but then from the other side, sort of zooming out and looking at the full picture. And that's what I always feel like I'm struggling to do, right? Zooming in on the piece that I really want to specialize in, and then
Yeah.
zooming out to see the forest for the trees, right? Like, and that's what we're constantly doing, zooming in, zooming out. Sort of like
Yeah.
your little optical machine thing that you do with people to see their
The
vision.
1 and 2. The 1
You
and
see
2.
how I brought it together?
1 and 2. Yes. Yes. There's a lot of things you could play with eyes and boarding. There's a lot of fun little
I love fun.
but yeah, so you're totally right. And that's where a lot of stuff, you know, a lot of conversations are lost when we just look at the one issue that you're going into your specialist for. And sometimes it's not so much your specialist is going to have every answer for you, but just give you suggestions to look into other avenues that you would never have put those
Right.
2 and 2 together. You know, one actual, I like that you brought up gut health, and it's not a specific thing, but there is, I see patients that have macular degeneration. And of course, there's a huge support with certain type of supplements and lifestyle changes for macular degeneration. But some of these patients are not absorbing their supplements.
Right.
And guess what? They're over 65, which puts a whole nother animal into play. They have, you know, poor HCl, or, you know, they don't have good digestive tract anyway. They're constipated. They have IBS. So it's almost like, yeah, we, you know, on the surface, obviously sounds good and easy. Like, just do this and have a nice day, and hopefully it'll help you. Versus, you know what? Why don't we look at the inflammation with the problem of the diet and trying to boost all your carotenoids, et cetera, like through the gut?
And I would argue also the benefit of having those carotenoids and those antioxidants coming in from your diet versus coming in from a supplement.
Absolutely.
Right. I would also argue that if your gut can't absorb it from the supplement, it's probably not absorbing it from your diet to begin with.
Yeah.
And I always say, like, I can give you the best diet in the world. You can be 100% compliant. That doesn't mean you're going to get 100% of the benefit of that diet if your gut is not doing its job and absorbing things properly. And then one more layer to add to that is the body doesn't know what to do. It doesn't go, oh, this person's going to an eye doctor, then I should take this beta carotene up to the eyes, right? Like, it's going, where do I need antioxidant power right now? And that might be like in your ankle, you know? So wherever that stress is, it's going to divert those antioxidants to that. And it's going to probably prioritize things like your heart and your liver and your kidney over your eyes. So there's something to be said also about the overall burden of what we call the oxidative stress of the stuff that's causing you to have an increased need for antioxidants, and where it's diverting those resources. And is it then is that why it's not getting it to the eyes and you're seeing some degeneration happening?
Yeah. And it's so important to know the general inflammation of that patient, because there's never a patient who's, you know, you just don't get that where it's just, you know, your run of the mill macular degeneration and there's zero anything else.
Right.
You know, no other, you know, I am healthy as can. I mean,
triathletes, you know.
I mean, there might be some cases, but I don't see it.
Yeah.
So yeah, it's an overall health consciousness on that case, and not just throwing a supplement, but that's what is the protocol typically in a general medical practice, where you just give them whatever supplement was the easiest to find. And then, I mean, going into supplements, you could even get, I get a little more nutty, because I find supplements that they have the lutein zeaxanthin and then they're boosted with beta carotene and they conflict. So this patient's like, I am doing my job, I am taking my eye vitamins, and I'm like, great. And then I look at it and it has ridiculous amounts of beta carotene, which competes with the lutein zeaxanthin that we need to get into the eye, and the absorption is poor of the top two carotenoids versus the beta carotene carotenoid. So
in that case, is that specific, like, is that the lens you're putting on in terms of, for your eye health, the lutein zeaxanthin is what's specifically useful, and taking excessive amounts of beta carotene is going to then compete And so you're
Mhm.
not going to get the eye health benefit. You're probably going to get like other antioxidant benefit, but not specific eye health. Is that what you're saying?
Yes, exactly. And also then there's enough research with beta carotene and smoking where the beta carotene actually turns into not an antioxidant, but the opposite. And it turns into more of an oxidant. And that
Yeah.
is linked to increased cancer rates and things like that for
So
lung cancer.
funny
So
you
it's-
bring that up. I literally was just reading about this the other day in the context of vitamin E. And the
Yes.
theory is that it's if you have if you're deficient in vitamin E, which is it's a fat soluble vitamin, yes, but it's
Mhm.
also another antioxidant.
Yeah.
That if you're deficient in vitamin E and you ramp up the beta carotene or vitamin A, then
Mhm.
you risk additional oxidative stress because you don't have the vitamin E to do its job in like sequestering some of those electrons that end up being produced as a result. And so it's interesting. Again, it goes back to what I was saying earlier about the benefit of a whole food approach or a whole antioxidant approach and a balanced antioxidant approach versus this sort of cherry picking of
Yeah.
antioxidants to support a particular need. And I think also it's worth talking about that deeper conversation of the gut microbiome and how we're actually, so there's two pieces here, right? There's one, what are the antioxidants actually doing? They're sort of acting as phytonutrients, are going in and
Yes.
modulating physiological behavior. In other words, they're going in there and they're telling our body to fix, repair certain things and to reduce damage. So one thing they're doing is sort of acting as a fire hose on a fire and
Yeah.
sort of quenching that. But they're also communicating to our genetics, right? They're modulating our epigenetics and they're communicating, hey, turn this on, turn this off, fix this, hold on that, right?
Yeah.
And so that's part of it. And then what I have been finding absolutely fascinating is the more recent research is saying that actually they use a medium, and that's the microbiome. And so they actually are communicating not directly necessarily to our genes, but via our microbes. And the microbes are actually interfacing in between what the phytochemicals are doing and what our genetic response is, which starts to like, it was like a huge aha moment for me. I'm like, no wonder you can't see a benefit from increasing somebody's phytonutrient density. Like you can't just say, eat a bunch of, eat the rainbow, eat lots of vegetables.
Yes.
But if the gut is still unhealthy, if the microbiome is still unbalanced, you don't see the same response. And so
No.
it was just such a huge aha moment for me because it's the bugs that are needed to implement the phytonutrient benefit and the nutritional benefit in general.
It makes sense. It makes
Yeah.
so much sense. Because that is one of my ultimate, I think if we want to really hone in on just AMD, which is the number one age-related macular degeneration, one of the number one cause of blindness over a certain age, 60, 65. So we want to hone in on why these patients have it in the first place, right? And go into obviously diet and oxidative stress from smoking, UV, all these exposures. But if we actually forget about the gut health, which is always not even, you don't even hear a word about gut health in AMD, which it really should be a top conversation, because even if we go simplistically and just say, these are the top carotenoids that help the eye, but if you can't digest it properly and it's not doing what it's doing and it's not talking to your genes, and then what are we doing?
Why are we here?
But that's where, I mean, I started doing some stool profiling here. I mean, I think it's, the conversation is so repetitive where whenever I see a patient with a lot of eye inflammation, I would say, I mean, this is not obviously scientific, but majority of the time, they don't write it on their intake form, but I say, how is and then it goes, oh, I just have diarrhea every day, or there's something.
It's always something. Yeah.
Oh, I'm looking for a good gastro. Oh, there's always something. And
Right.
yeah, I totally agree with you that there's probably some sort of sense. I mean, obviously the microbiome, the genetic profile of the microbiome is like trumps our genetic profile, right?
Yeah.
And so it's, why wouldn't it connect in that
Absolutely.
way too? But so then, and then let's talk about the earlier point, and that's kind of where I wanted to gear this conversation is, so let's say you are at that age bracket and things have already started and you're already on that unfortunate, train of going down inflammation in the eye, but we're not talking about being proactive younger.
Hmm.
So where are we? So when our gut health is maybe a little bit better, right? And maybe we have better systemic kind of way of absorbing these carotenoids. And now we have other oxidative things like our phones
Right.
and our LEDs and being indoors and, a quarantine.
Right. Right.
So why can't we at least minimalistically try to help at a younger age to be proactive to have the proper carotenoids in the eye?
Absolutely. And isn't
So
eye health also, isn't it in some cases, it's sort of an early indicator of general oxidative stress? Did I read that somewhere? Am I right about that? That you can use that as a barometer for certain oxidative stress?
absolutely. And right now, one of the biggest connections are, or they're trying to really make it pretty easy to use in a clinical setting, is markers for Alzheimer's in the retina.
Mm-hmm. Mm-hmm.
So, the ocular tissue, or just, first of all, where else in the body can you see a nerve that's exposed? So we see the optic nerve.
Yeah.
Where else do you see blood vessels without any skin? So we
Right.
see the vascular system. We actually see the flow. We could see the pulsation in your vessels in the eye.
Yeah.
So, I mean, you could argue a lot more than just having that imbalance of oxidation, but there's so many connections that can be made by just looking into the eye.
Well, I could see the dementia Alzheimer's piece, because one of the, if you read Bredesen's work on his book End of Alzheimer's, he talks about the 5 types of Alzheimer's, and one of the most prominent ones is vascular degeneration. So if you can sort of look at the vasculature in advance and see what it's doing in advance, that could give you a clue. Totally makes sense to me. It could give you a clue as to what might be happening, in the vasculature leading up to the brain.
Yeah, because the retinal tissue is brain tissue.
Yeah.
It's not, and that you're looking at your brain through your eye.
That's fascinating.
It is fascinating. And it's, I mean, we're just at the early tip for, studies in that department. But yeah, so going back to the lutein and even lutein is, it's great for the brain. Cognition. There's studies that have come out for cognition with lutein improvement.
Wow.
So it's not just an eye vision. No, it's one of the few carotenoids that are in the brain.
Yeah.
And so there's a lot more to it than obviously the macula, which, as I said, that's where the majority of the lutein zeaxanthin concentrate. But I think it's just the early phase of all of this where we're going to see so much more information. But I think for us to be proactive at this point is to try to get as much as we can naturally through the food and diet. A lot of people think, obviously spinach and kales are top notch for lutein. But I actually did a smoothie video just last week and I cooked my spinach.
Yeah.
And chopped it up and put it in the smoothie.
Why did you do that?
Because guess what? The nutrient value goes up.
Interesting. So, Dr. Deanna Minich actually talks about this. And I know she was one of your professors at UWS. And one of the things that, she said that I heard her say this years ago, and it's stuck in my brain. A lot of times these phytochemicals are released with heat. So if you've ever steamed broccoli, You know, you
Mhm.
put the broccoli in, it's got this sort of dull green color to it with a little bit of, it's got a little
Yes.
ashiness to it. And then you steam it and it pops.
Right.
Right?
Right.
Like that
Yeah.
green just comes out. And she's like, those are the phytochemicals activating. And so this idea that we have that we always have to eat our food raw, and that's the best way to preserve its nutrient values, actually false. Some
Yeah.
nutrients decrease, you lose
Mhm.
some, but
Yeah.
others are actually activated by that. And
Hyper.
part of it is that phytonutrient profile. It's actually activated by a little bit of heat.
Yeah. So, implementing those little tricks, especially for patients who are already suffering, obviously,
Mhm.
we want to up whatever they're able to do on their daily routine. We want to give them the highest nutrient value, right? Naturally. And also teaching a little bit of that population of not to be afraid of fats, because their fat is fear for them, because they've been brought up with the anti-fat.
The 90s, I was there. Yeah. Mhm.
Yeah. So, but this is again going back to the carotenoid absorption part of it. They're actually fat soluble.
Mm. Right. They
Mhm.
are, because they're fat soluble vitamins are derived. Yeah, they turn, yes.
So that's, it's getting a little ridiculous, but it's almost like a simple, I tell my patients, I go, I love how you're having salads, but don't get the no fat dressing.
Yeah.
Because it's the power of that combination to get it into the intestine with a fat carrier, which is a little bit of EVOO.
And this is where my sort of bias comes in, because I'm already thinking, well, are they even absorbing those fats? Because if they're having digestive issues and they're not
Yes.
absorbing the fat, they're
Yep.
also not absorbing the fat soluble nutrients that go along with them, right? The carriers.
Yeah. And who has their gallbladder removed? Who's been on proton pump inhibitors for, I don't know,
A million
3 years
years.
straight,
Yeah.
at least. So there is a lot more aggressive dietary changes with actual absorption. If you really look at the absorption piece of it, you can really get into serious conversation with these patients on how they're eating, not just what they're eating, but how they're eating it.
It sounds like there's 3 barriers, right? The first barrier is, are they eating the nutrient dense food that contains those carotenoids? 1.
Period. Yeah.
Barrier 2, are they eating enough fat to carry those nutrients and absorb it if they do eat it? And 3, what is their gut health look like and their ability to actually leverage that content? So 1, are they eating the carotenoids? 2, are they eating the fat carriers? And 3, are they absorbing the fat carriers with the carotenoids?
Yeah, and where we stand medically on we barely get to number 1.
Right.
So,
and we haven't even scratched the surface, Nadia, about whether or not they're having a quality supplement. Like, is that supplement even a good quality of zeaxanthin or lutein? Or we haven't even gotten to that part yet.
Well, yeah, I've very often taken people off supplements. I literally, I'm like, if you don't come in with your supplement, we can't have a conversation, because I need to know what it is.
Mm-hmm.
And oftentimes I'm like, guess what? This is garbage now.
Oh, I'm glad you brought it in. It's going in my trash.
Yeah, I'm so sorry you spent so much money on that. But, but that's, I think of it as value. And I'm a coupon lady. I like my coupons.
She is gone.
I've
known her for a very long time. She really is a coupon lady.
I don't like people buying supplements that are not good, or they're not getting value out of it. It actually hurts me on that kind of end too, that, some of these patients they're just on Social Security or whatever.
Right.
And a lot of these supplements, they're not supported with Medicare coverage. So even though I think it should be, because
most of them are not. Yeah.
Yeah, most of them are not. So
and they're expensive. They're not cheap.
Very expensive. Yes.
Oh my gosh. Like a little bottle for 30 days can be like $20, $25 easy. Mm-hmm. And that's not even the good stuff. That's like mediocre stuff. So they are definitely expensive. Do you have some favorites? Do you have some favorites?
I actually, there's a few. It depends on the patient's like nutritional status to begin with. I do like Eyesight. Actually, one that made a cool version was Eyesight by Zymogen.
Oh, yeah.
It hits a few of the top stuff. I do also like Zeavision. That's another one that I prescribe. And Pure Encapsulation has an eye version that's really good too. But then again, it also depends on the status of the patient. So if it's more of a pure lutein and zeaxanthin boost where they want to help really promote improve macular health against blue light, because that's another conversation, not just age-related macular degeneration, but blue light therapy, where you are trying to boost your macular zone to combat blue light oxidative stress. Because that's another hot topic where digital exposure, what does that do, right?
I'm curious. You know, we've been super screen focused, I guess, for lack of a better, like we've been using screens. You know, it's been gradually increasing, but I'd say it's at least 15 years that our screen time has significantly increased, particularly when, you know, smartphones came out, but even laptops and, you know, iPads and things like that. I'm curious if you've been seeing an increase in degeneration due to that, or any other shifts that you're seeing as a result of screen time. We all know, you know, screen time disrupts sleep, and we know that screen time can add to anxiety, especially depending on the content that you're viewing. But I'm curious from a eye health perspective if you're noticing a shift as well.
I mean, I think right now it's still premature to connect it with actual damage. There are some mice studies that are out that really do connect those two, where blue light, but unfortunately the emission of the blue light was very high. So it's like if you go out in the sun and you stare at the sun, your eyes are not going to do so well. That's blue light on steroids, right? But the argument is that not so much the percentage per screen, it's the length of time and the environmental. So, you know, meaning you used to watch, you know, be on your phone, let's just say an hour. And now your phone is your computer. Right. But now you've changed every bulb in your house as well, right?
Right.
And so it's the added, and that's where there's a lot of controversy on what it's really doing damage-wise to the retinal photoreceptors, because there is always a balancing act of that, you know, oxidation balance of how much can it take, because that's the goal, is for these carotenoids to absorb all that blue light before it hits the rest of the retina and damages the photoreceptor line. And what, you know, going forward, we don't know, but we do know that there's protection with lutein and zeaxanthin.
Okay.
In general.
So lutein, zeaxanthin, trying to get them out of our food. I'm trying to protect my eyes, girl. Like, so like, what are we saying here? We want lutein and zeaxanthin as in food sources as much as possible. There's some supplements out there if we need a little added boost, but you know, food first. I think we're on the same page with that. And then blue light blockers, do you think those are an added benefit as well?
Blue light blockers is a very complicated conversation because there is no standard of care.
Okay.
So when I say that word, or, you know, there's no, oh, this is, you know, you might see something that says blue light blocking. You don't know what percentage it's at.
Yeah.
And then we have the visible spectrum, and there's the highest level, usually around 435 nanometers. Where does those blue light glasses block at that level?
Okay.
They don't tell you.
Okay.
Unless there's some companies do. Okay. And those are the ones that, and it goes back to vitamins. So it's like, oh, this is my vitamin magnesium. Oh, that's great. What does that mean?
Right.
Or, you know, my multivitamin, which has goods and bads. But then again, with blue light glasses, how much are they blocking?
Right.
What nanometer is it targeting on the spectrum? because obviously the higher the energy, the more damaging it is.
So
So
basically
I
what I'm
do think they're
hearing,
good.
Nita, is that you don't trust don't put the blue light blockers on and assume that that's protective. You still need to focus on the antioxidants, and you still need
Yes.
to focus on the carotenoids.
Unless you know that company is well researched and they tell you the answer, what
Yeah.
they're blocking, how much they're blocking.
Yeah.
So that's the other part of it, that you have to just know what company you're dealing with and are they actually doing the right thing. And
Yeah.
I'm actually doing a fun blue light thing with Kevin, who's my husband.
Hey guys, sorry, I just
Yeah.
want to interrupt here quickly.
Sure.
So we've gotten to the free part, so the meeting is going to end in 2 minutes, so we can just
Okay.
kind of start again. I just tried to upgrade online, but it's not working. So can we just start over? Well, not over, but just stop this and then just come back and continue where you guys just left off.
Yeah, I see. It's like counting down 1 minute and 43 seconds. Yeah, I think do you need to send a new invite, or can we use the same link?
I believe you can use the same link. So I'm gonna
Okay.
stop the recording.